Good morning. Myself, Dr. Pallavi Ashrit. So today let us start nutrition and also BMR, that is basal metabolic rate. Okay. So nutrition in a broad sense means healthy food or balanced diet. Okay. So in this present situation, there are many disorders that are mainly because of improper nutrition and also deficiency of the nutrients in the diet. So we are supposed to plan our diet such that all the nutrients are there in the diet so that there won't be any deficiency or disorder. So nutrient means it is a food substance required for normal growth, functions and also maintenance of an organism's health. Okay, so human beings require many nutrients, major or minor. So that includes carbohydrates, fats, proteins, which are major nutrients, and minor ones include minerals and vitamins. Okay, so it should be taken in a well balanced manner. So now let us discuss basal metabolic rate, also called as BMR. You all might be knowing about this. Okay. So the amount of energy required by the body under conditions when it performs minimum possible work, it is called as basal metabolic rate. Okay. So in other words, it is defined as the BMR at complete physical and mental rest, but the person should not be sleeping. Okay, so it represents the minimum amount of energy required to maintain basic physiologic functions. We might think that only while walking or while doing any activity we spend some energy. No, it is not like that. Actually, we spend energy during rest also. Okay, so the activities during rest include the activity of the heart, okay, like pumping, contraction, relaxation and all, respiration and conduction of nerve impulses, ion transport across membranes. Then the kidneys will also function during rest, that is reabsorption. Then temperature regulation, body temperature regulation. So all these and many more will be taking place during rest also. So there are some prerequisites or the conditions that are necessary during the study of basal metabolism in a subject or an individual. So the person should be awake, he should not be sleeping, but at complete physical and mental rest. And he or she should be in post-absorptive state, should be in recumbent or reclining position in the bed. Comfortably he or she should be placed. Should be at normal temperature, pressure and humidity. Then let us know the normal values of BMR. The basal metabolic rate values are expressed as kilocalories per square meter of body surface area per hour. In normal healthy adults, the BMR value is 34 to 37 kilocalories per square meter per hour. So this is in healthy males, and in females it is 30 to 35 kilocalories per square meter per hour. Then how to measure this BMR? So there are two devices. One is closed circuit device and the other one is open circuit device. So closed circuit device is more commonly used method. So that is Benedict Roth method, and open circuit device is less commonly used and it is Douglas bag method. Here we should be knowing the body surface area of an individual. Then we can calculate the BMR. Now let us discuss about the factors affecting BMR. Means what are the factors that will either increase or decrease the basal metabolic rate. So first and foremost is the age of an individual. The BMR is very much low in the extremes of age, that is in infants, children, and also in the elderly people, old age people, it is low. Okay, mainly because the muscle tone is less in these people. It is high during the middle age of an individual. Not just age, gender also affects BMR. It is the BMR is more in males and it is less in females when we compare between males and females. Then the BMR in nutritional state means in a well-fed person BMR is more, whereas in the state of starvation or undernourishment the BMR is less. Next, moving on to the body surface area. The basal metabolic rate is directly proportional to the body surface area. The body surface area is more, the basal metabolic rate is more, and if the body surface area is less, the basal metabolic rate is also less. Then moving on to hormonal state, means which all hormones affect BMR. Okay, so mainly the thyroid hormone plays an important role in affecting the basal metabolic rate. Okay, so the BMR is less during hypothyroidism and it is more in hyperthyroidism. This is the reason why the hyperthyroid patients are lean and the hypothyroid patients are obese. It is because of BMR in hyper and hypothyroid status. Okay. Next is stress, anxiety and other disease states, then burns and cancer conditions also increase the BMR. Okay. During these conditions the basal metabolic rate is more. And about environmental temperature or climate. Okay. In colder climate the BMR is higher. This is because the body has to maintain the temperature during cold seasons or winter seasons. Hence the BMR is higher during cold climate and it is lower during hot climatic conditions. Okay. Next is during exercise. During exercise what happens? The muscular activity is more, hence it requires more and more nutrients, and also this is helped by the heart. Okay, so it will pump more and more blood to the muscles during exercise. So cardiac output is more, hence the BMR is more during exercise or increased physical activity. Then during fever also the BMR is more. Okay, it is said that every 1 degree Celsius increase in the body temperature, the BMR, that is the basal metabolic rate, increases by 12%. And also the drugs like nicotine, which is present in the cigarette, then caffeine present in coffee and theophylline present in tea also increases BMR. Then last but not the least, we should know what are the applications of this basal metabolic rate. Why we should know about basal metabolic rate? What is the importance of knowing this basal metabolic rate? Okay, so in clinical biochemistry we not only teach regarding the subject, this is related mainly to the clinical applications. So during normal or disease states, what is the role of knowing biochemistry? Okay, that is mainly referred to as clinical biochemistry. So here it is not about just knowing the definition of BMR or normal value of BMR and also the factors affecting the BMR. Here we should know in what all diseases or clinical conditions BMR has its role. Okay? So it is useful for the diagnosis of thyroid disorders. So I have already explained the same topic in under factors affecting BMR, that is the hormonal status. Here BMR is low in hypothyroidism and it is elevated or high in hyperthyroidism. And then BMR is used in calculating the caloric requirements of an individual and planning of diets. Okay? So it should be kept in mind during planning the diet because BMR should be considered as an important factor during planning the diet for an individual based on the factors like age, then disease state, then gender, then the level of physical activity and also the hormonal states. So dear students, this is very important. BMR, many other factors are there, topics are there in nutrition. We are supposed to keep all those under consideration like SDA, specific dynamic action, then the physical activity and BMR. These three should be kept in mind for calculation of caloric requirements of an individual. It is totally different for all individuals. So if a diet is planned for a person, same diet cannot be applied to other person because the individuals differ in many factors that I have already explained. Okay, so we should keep in mind, and there is a formula to calculate the energy requirement. Under that we should consider BMR, then specific dynamic action and also the physical activity. This physical activity again has different levels, okay, like occupational, non-occupational. Again under occupational, mild, moderate, severe, or we calculate as sedentary lifestyle, and the person doing mild activity, moderate physical activity, severe physical or heavy workload. Okay, so based on this we calculate the energy required. Thank you.